Hello, and welcome to this National MS Education and Awareness Month teleconference, hosted by MS Focus, the Multiple Sclerosis Foundation, and made possible with support from Biogen, Novartis Pharmaceuticals, EMD Serono, Genentech, and Sanofi Genzyme. I'm your host, Casey Minnis, Director of Communications for MS Focus, and I'm joined by Anna Berry, Doctor of Physical Therapy, who will discuss the topic Learning to Adapt Using Rehabilitative Therapies. Please note there are slides available for this presentation. To view them, go to readytalk.com and join with the access code 776-6805. Again, that's readytalk.com and the access code 776-6805. Now, allow me to tell you a bit about our speaker. Anna Berry is a physical therapist and the MS Rehabilitation and Wellness Manager at the Eula C. and Andrew C. Carlos Center at the Shepherd Center in Atlanta, Georgia. She's been at the Shepherd Center for 7 years, working with patients with MS for 5 of them. Her undergraduate degree is in psychology, and she has a doctorate in physical therapy. Her dream is for everyone living with MS to thrive as a result of quality, comprehensive medical care that is easily accessible to them. Dr. Berry, thank you for being with us, and I'll turn it over to you. Dr. Berry?
Yes, hi. Thank you so much. When I was asked to do this presentation, I didn't really, had to do a little bit of research in terms of what did we mean by adaptability and how can we adapt to therapy. And once I started really looking into it, I realized it's something I'm passionate about and didn't even realize it, but it's a way that everyone living with MS can access this care. So the objectives of tonight's talk will be to define adaptability, to briefly define physical, occupational, and speech therapy, recreational therapy, vocational rehab, and counseling, to define wellness, and then I want to put it all together in 3 different ways from the view of the adaptation definition, based on symptoms, and based on therapies. So I got something from the MSF. It's called the MS Change the Focus, a toolkit for the MS community, and that is where I found this definition of adaptability. And so it's defined as the ability to make appropriate adjustments in thinking and behavior in the face of new or uncertain situations, or also you can think of it as go with the flow. So if you have the slides, you have a picture of a girl raising her hands and saying, I have no idea what's going to happen, and I love it. And that's what I think of when we think of go with the flow, which is obviously a lot easier in that picture than it is in real life. To get more specific about the definition of adaptability, in this MSF toolkit, it defines adaptable people, or it characterizes adaptable people and also those with difficulty adapting. So it talks about that adaptable people can focus on opportunities, whereas those with difficulty adapting may focus on problems or losses. Adaptable people accept change as a part of life, whereas those with difficulty fight against or resent changes. Adaptable people move on from disappointments, whereas those with difficulty may dwell on disappointments. Adaptable people ask for help when needed and are open to new methods. Those with difficulties reject help when offered and want things done the right way. Adaptable people find things to look forward to, whereas people with more trouble adapting look back with longing. So we're going to work with that framework when we're talking about adaptability in this presentation. And now to move on to briefly talk about rehab therapies. I'm sure most of us know what the majority of these therapists do, but I did want to talk about them briefly just to make sure. In this there are more therapists than just that are listed here, but these are the ones that are the most familiar to me, and I think the most common in most outpatient settings where the majority of people with MS would be seeking treatment. So I'll start with physical therapy. The American Physical Therapy Association defines PT as highly educated, licensed healthcare professionals who can help patients reduce pain and improve or restore mobility. PTs examine each person and they develop a plan of care, and the plan of care will hope to promote the ability of a person to move, to reduce their pain, improve their function, and prevent disability. Occupational therapists are very similar to PTs, but by definition, according to their national association, OTs address the physical, cognitive, psychosocial, sensory, perceptual, and other aspects of performance in a variety of contexts and environments to support engagement in occupations that affect physical and mental well-being and the quality of life. OTs and PTs, as I said, are very similar, and I think you could spend the whole hour talking about the similarities and differences between OTs and PTs, but a very simple way to think about it, and kind of how we think about it at the Shepherd Center sometimes, is a PT can help you get to where you're going. So a PT can get you to help you walk from your kitchen or from your bedroom or your dining room to the kitchen, and an OT will help you do what you need to do once you're there: wash dishes, cook, or a PT would help you walk to the bathroom, whereas an OT would help you get in and out of the bathtub and bathe yourself. So that's just an easy way to think about the difference between them. Obviously, it's very simplified. Speech therapy. Speech therapy is performed by a speech-language pathologist, and they work to prevent, assess, diagnose, and treat speech, language, social communication, cognitive communication, and swallowing disorders in children and adults. A lot of people will tell you, I don't need speech therapy, I speak just fine. But that is not the only thing that a speech therapist can help people with. Sometimes I think of speech therapy as the glue between all the other therapies. So, for example, if a PT and an OT work together and give you this beautiful home exercise program with recommendations for your home setup, it's the speech therapist that's going to help you organize that once you get to your home. Speech therapists can help with daily schedules. They can help with medication reminders. They can help with short-term memory, long-term memory. Speech therapists do a lot more than just help with speaking. Vocational rehab or vocational therapy provides services to help eligible persons with disabilities prepare for, start, and maintain competitive employment, thus becoming productive and independent citizens in their communities. Recreational therapists. These are not super common in outpatient settings, but you will find them, and you can certainly seek one out from a website or from calling a local outpatient or inpatient therapy setting. But it's also known as therapeutic recreation, and it's a process that utilizes recreation and other activity-based interventions to address the assessed needs of individuals with an illness or disability. So, for example, if someone said, I love to play golf, but I don't have great balance and my arms aren't as strong as they used to be, a recreational therapist could use golfing as part of your therapy. So they're very well versed in all of the equipment available to people who have disabilities to help them play golf or ski or scuba dive, do art, do whatever it is that they love to do, and not in the same way maybe that they used to do it, but just finding a way to access those activities as both a way to get stronger and just to provide the psychological and physical health that goes along with doing activities that you love. Counseling psychology, according to the American Psychological Association, is a general practice and health service provider specialty in professional psychology, and it focuses on how people function both personally and in their relationships at all ages. So I also wanted to define, we've defined adaptability, we've gone through different therapies. I did want to talk about wellness too, because I think it really comes into play when we're talking about adapting and accessing therapies. Wellness is, I want us to all think about why we called in tonight or why we logged on the computer tonight, and I would like to suggest that it's probably because you want to be more well. And I think that after really looking at the word adaptability and thinking about what that means, you have to be adaptable in order to reach your most well-being. And so I want to delve just a little bit further into wellness before we start putting it all together. A while back, I think wellness had a bad rap. When you hear the word wellness, you would possibly think of hokey wellness retreats where you did yoga, and it was viewed as sort of this alternative type of health. But now we're coming around and we're defining it differently. In fact, the National Wellness Institute defines wellness as an active process through which people become aware of and make choices toward a more successful existence. I like this definition a lot because it talks about us making choices towards a more successful existence, and I think you have to be adaptable to do that. There's a difference between health and wellness, I think. Health is a state of complete physical and mental and social well-being, and not merely the absence of disease or infirmity. To me, health almost seems a little bit of a passive definition, whereas wellness is a quality or state of being healthy in body and mind, especially as a result of deliberate effort. So in order to be well, you need to seek, I believe you need to seek out wellness. Anybody needs to seek out wellness, not only people living with MS, but in order to be our most well self, there are actions we need to take. So as you can imagine, there are many, many models of wellness. My personal favorite is the National Wellness Institute's model, and it has 6 tenets. The tenets are social, occupational, spiritual, physical, intellectual, and emotional. Physical wellness is fairly obvious. I think a lot of us probably when we think of wellness, physical may be the first thing that pops into your head. But physical wellness encompasses regular physical activity, healthy eating habits, strength and vitality, as well as personal responsibility, self-care, and knowing when to seek medical attention. Social well-being is defined as being able to contribute to one's environment and community. Vocational wellness is defined as the enrichment of life through work and its interconnectedness to living and playing. Spiritual wellness is the development of belief systems, values, and creating a worldview. Intellectual wellness is self-esteem, self-control, and determination as a sense of direction. And finally, emotional wellness is an awareness and an acceptance of one's feelings. Emotional wellness includes the degree to which one feels positive and enthusiastic about oneself and about life. So when I think about wellness and when I think about what is ideal for everyone, and when you have MS, is to have a balance of all of these tenets. So if you were the most physical, well person, and you could scuba dive and jump out of airplanes and run marathons, if you were not emotionally well and you couldn't leave your house, it wouldn't matter how physically well you were. If you had a great job and you were able to get there every day safely and you felt good while you were there, so you had great occupational wellness and great physical wellness, but you were depressed when you got home, it wouldn't matter. So point is, balance is key, and being well in every one of these tenets is very important. As I thought more and more about wellness and about adaptability, it became obvious to me that adaptability is something that will get you over any obstacles that could get in the way of becoming your most intellectually well self, your most spiritual well self, emotional well self, and et cetera, all the way around the wheel. And I think that therapies can help get to that point, along with adaptability. So that brings me to putting it all together. So how can we use all the therapies we have available to us and to help us adapt and get to our most well self? So I talked about looking at it from 3 different perspectives. The first way is simply looking at it from the definition of adaptability that we talked about. So again, this is from the MSS Tool Kit, and if you don't have it, I really recommend getting it. It's wonderful. It talks about the definition of adaptability, and then it goes through just sort of some questions to ask yourself and some goals and how to sort of look at yourself and know if you're as adaptable as you can be. But I found it really interesting, and I've passed it on to several patients who have appreciated it. I'm assuming it's probably online. Maybe that's something Casey can help with us at the end of the presentation, is how to access it. So again, a characteristic of adaptability that I think is important to accessing therapy is focus on opportunities rather than focus on problems or losses. So before I talk about this, I wanted to briefly talk about the difference in therapy between recovery and compensation. So typically when I start with any of my patients, I will tell them, they'll say, for example, I want to be able to walk better. And what's holding them back may be a muscle that's not as strong as it could be. For example, tibialis anterior is the muscle that raises our foot, our ankle, toes when we're walking. So you probably have heard of foot drop, and that's caused by a weak tibialis, can be caused by weak tibialis anterior. There's other causes too. So when I'm treating that patient, I tell them I'm going down 2 roads as we're treating foot drop. We are going to work together to strengthen your tibialis anterior, to literally make that muscle stronger so that it can lift your foot and your gait pattern is better, which is your goal. So we are going to do everything we can do to get it stronger. So in a physical therapist toolbox, for example, we can just do basic strengthening that an exercise specialist would do. We can use electrical stimulation. We can use tactile cues. We can use visual cues. So we're going to throw everything we've got at you to get that muscle stronger. But at the same time, you are sitting there in front of me right now and you want to walk better. And I can't tell you when your tibialis anterior is going to get stronger. And I don't know for sure that it is. I believe that it is. We both have to believe that it is, but we don't know for sure that it's going to. So at the same time, we've also got to travel down this parallel road of compensatory strategies. So that could be an AFO, which is an ankle-foot orthoses. So it's compensating for the weak muscle. We haven't necessarily strengthened that muscle yet, just because it's physiologically impossible to strengthen a muscle that fast. But you want to walk, and you want to do what you want to do in your life, and that's going to give you the ability to do it immediately. So again, we're traveling down two roads. We're traveling down recovery, and we're doing everything we can to actually make a physiological change and improvement in someone's function. And we're also providing compensation simultaneously. So I wanted to define those because it helps me talk about adaptability, and you'll see why as we talk about it. So again, people with adaptability focus on opportunities. Those with difficulties focus on problems. So the problem can be, I can't walk as far or as long anymore. Well, what could a therapist do to help you adapt to that? Well, as I said before, we could help you recover. You could come to PT. That would give you the opportunity to improve. You could try functional electrical stimulation. You could join a wellness program. You could join a walking group. You could try a cooling vest that may help you walk a little further or longer. All of those would be considered recovery strategies. We may also want to compensate so that you can do what you want to do right now. We may give you an AFO for right now. You might not need it forever, but it'll help you right now. You might want to try one of the walking devices we have that utilize functional electrical stimulation. Or to adapt, we may want to just change the activity. You want to walk because you enjoy socializing while you walk. Well, what if you did hand cycling with a team of hand cyclers, or what if you did swimming? Those are examples of how a therapist could help you adapt, compensate, and or recover. Another problem that you could have, my memory is not the same anymore. I think we could all say that, but a speech therapist would probably be the first person that would help you with that, to help you recover, in other words, to improve your memory. There are many things that a speech therapist have to do for that. Playing memory games will help. There are apps on phones and computers, iPads, that will help you improve your memory. There's also cognitive groups, like a group session in an outpatient setting, where they can guide the conversation so that you're constantly challenging each other's memory. But there's also compensation strategies, which will help you adapt to your memory. You could make a to-do list. You could use a memory book. You could set up phone reminders. You could set up a detailed daily schedule, medication reminders. A speech therapist could help you do all of those things. A problem. I miss riding my bike and races. An opportunity. You could come to physical therapy. You could come to occupational therapy. You could use a cooling vest. You could train in shorter spurts. Or we could compensate or adapt. You could try a hand cycle instead. You could go for shorter distances. You could decrease your speed, or you could try a tandem bike so that your partner riding with you is helping you to conserve your energy. So we just talked about examples of how to adapt by focusing on opportunities versus focusing on problems or losses. Now we're going to talk about accepting changes as a part of life versus fighting against or resenting changes. And I will say that when I read this one, a light bulb went off a little bit, because I have talked to other healthcare providers, and we always say right after eval, we kind of get this feeling of either this is going to be really good and really helpful for this person, or it's going to be more of a challenge. And we couldn't put words to what it was, but I actually think that this is it. I think it's just the ability to go with the flow, or just accept these changes as a part of life and finding a new normal. When you're open, we're not saying that anything we recommend, you have to say, okay, absolutely, that sounds good. But at least just being open to change and doing things, finding a new normal, doing things a little differently. So, for example, again, the definition of adaptability with these characteristics: people with adaptability accept change as a part of life. Those with difficulty fight against or resent change. I think all of us probably have a moment when change does not sound good. But then I think if you're able to, while you're receiving therapy, have an open mind and hearing it out and trying it, you will have a much better result. So, for example, fighting against change. I will never be happy walking shorter distances, accepting the change. It's okay to walk shorter distances because I can still gain the same benefits. I can take rest breaks while I'm walking. I'm not okay with an assistive device no matter how much it helps me, versus I'm going to have a conversation and find the assistive device that works the best for me. I may not be comfortable with a rollator, but I wonder if I could use 2 canes or walking sticks, or if there's something else we could come up with together to help me walk or help my balance. I do not like my planner, and I'm not going to use it, versus I want to use a planner because it allows me to plan. It helps my short-term memory, and it makes sure I'm connected with all the things that are important to me. So again, at the Shepherd Center, we say this is your new normal. So there's a picture here that says, keep calm. This is your new normal. So the last definition of adaptability that we'll talk about, or characteristics of adaptability that we'll talk about before we move on, is people who are more adaptable are open to new methods, versus people with difficulty adapting want things done the right way. And I think the right way sometimes is instead of the right way, it's the old way, or it's the way that I'm the most comfortable with right now. So a therapist can help you through this by, the right way or the old way, maybe walking like a 20-year-old forever. Well, none of us can do that. So we might have to use an assistive device, or we might have to walk slower or with a different step length, a different step cadence. The right way or the old way may be riding an upright bike. Well, a new method might be riding a recumbent bike or riding a hand cycle. The right way or the old way, not using glasses. The new way, using glasses to see better. The right way or old way, I used to run marathons. A new way might be using functional electrical stimulation on a FES bike, or walking for exercise, or seeking out the assistance from a recreational therapist to access a different type of equipment that would allow me to get the same feeling and satisfaction from running marathons. The right way or the old way may be running up the stairs, not holding on to anything. The new way could just be walking up the stairs slowly, holding on to the handrail, or using an elevator. The right way or the old way could be standing in the shower, closing your eyes, singing. The new way could be sitting in the shower or tub, using grab bars, being safe about the surface in the shower with non-sticks. And OT is helpful in that arena. So I think looking at adaptability and therapy from that perspective demonstrates how important adaptability is in order to get the most out of therapy, and really to access therapy the fullest and the fastest. So I think if you go into therapy and you are adaptable, then the therapists sort of have the window to immediately come in, try things, and make the decisions that make the most sense for you, and help define your new normal or your new way of doing things. But now we're going to look at it through the eyes or through the realm of symptoms. And I have not included every single symptom, and I know that not everyone has the same symptoms, but I chose the 5 that we see the most in outpatient therapy and chose to focus on those for this presentation. So those are muscle weakness, decreased balance, spasticity, decreased memory or trouble with thinking, and depression. So I'll start with muscle weakness. So adaptations that therapists can use to overcome muscle weakness. Now, I do have to say, of course, every time that therapists can recover muscle weakness. We're not always having to adapt for it. You can get stronger. You will get stronger. But we can also make compensations and adaptations simultaneously, which a lot of times can give us instant gratification, which I think we all like. But for example, a therapist can help you with a different setup in your home. So, the best example for that, I think, is energy conservation. When you have a path that you come into the door, your keys go right here. You typically then walk to the kitchen and you get the same glass. Well, maybe we leave that glass lower. You can touch the faucet for the water to come on. That could be a whole nother presentation, too, on modifications you can make to your home to conserve your energy and make it more accessible to you. But that's something that a therapist, an OT or a PT or a speech therapist can do to help you access what you need to access in your home and do it in a way that's the most energy efficient. They can also show you different ways of moving. You can stand up. You can perform a sit-to-stand from a chair in many different ways. So if that's something that takes a lot of your energy, we can show you how to do it in a way that only takes up a tiny bit of energy. I always say be careful with that because I want you to get stronger every time you stand up from the chair rather than standing up from the chair in the easiest way. But there are times when you need to conserve your energy, but there are times when you need to challenge yourself too. So that would be part of a therapist educating you on when are the times to challenge yourself and when are the times to just take it easy. You can, a therapist may recommend, this goes back to home setup, but using stools or chairs around your house strategically to, again, decrease or increase your energy efficiency as you're cooking or brushing your teeth, putting your kids to bed, feeding the animals, just show you strategies for where to have things to make it the easiest for you. Therapists can provide bracing to help with muscle weakness. OTs will typically make a splint, and these are devices that go on your hands that'll help with positioning, and they can also help with movement. There's dynamic splints too. There's FES, which I've talked about quite a bit. I am a big believer in FES, which is functional electrical stimulation. There are upper extremity units that can stimulate the muscles you use to grip things. That can be used both functionally, sort of as a compensatory strategy, but also since they're providing electrical stimulation to your muscle while you're moving your muscle, it also is, I believe it's making your muscle stronger too. So there's devices for your upper extremity and your lower extremity. We've talked about an AFO. There are hundreds of different types of AFOs. There's tiny AFOs, there's big AFOs, there's light AFOs, there's heavy AFOs. There's AFOs that we've had people use which have helped them complete a half marathon because the only thing that made them, the only symptom that they had when getting to the half marathon was foot drop. So we needed to get them a very lightweight brace that would help them at the end of the race to complete the half marathon. So there's all different kinds of AFOs. There's AFOs that can impact your knee and your hip, and then we can even go all the way up your leg with bracing. Those tend to be heavy, but they're good for weight bearing. We love to use cooling vests and cooling equipment. I really do think that for a lot of people it makes a really big difference in letting them get a little bit further into their day before needing to rest. We have very small ones that can go around your wrist. We have small ones that you can tuck into a hat if you're outside. We have little ones that can go into undergarments. So it doesn't, we say vest, I think, but really there's all kinds of different cooling equipment that can help. There's different straps that you can use to help with foot drop. There's a tiny little one that attaches to your ankle and your shoelaces that can help. And there's all kinds of equipment for your home, which we'll go into in a few minutes. All of those things can help with muscle weakness. The next symptom that we'll talk about is balance. Balance, again, you know probably what I'm going to say. We can recover balance. Your balance can absolutely get better, and that's usually something that can get better pretty quickly. But also we can compensate for it. So ways to adjust or adapt to decrease balance are to increase visual cues. So you probably have already heard this, but if you get up in the middle of the night to go to the bathroom and you leave the lights off, it is a lot harder to balance. We rely on our vision for cues from the environment to tell us where we are in space. So a very easy adaptation for that is to get motion sensor lights so that before you even sit up, you can wave your hand and the light comes on. They have them in Costco. They're wonderful. And then as you're walking into the bathroom, the next light will come on. The light in your bedroom, it can be on a timer, so you know it takes you, 20 seconds to walk to your bathroom. It'll turn off. So if there's anyone else in your room, they're not bothered by that light longer than they need to be. So lights can help with balance. Also, increased proprioception. Proprioception is our ability to feel where we are when we're not looking. So we rely on proprioception a lot from our feet. Our feet can tell us. You may have noticed it's easier to balance sometimes in bare feet. It's very easy to balance on a hard surface because our feet are giving us the correct cues. If our balance shifts forward, we feel that and we know to shift backwards. Now pretend you're on a beach. You're on a beach and the sand is not really giving you the exact cues that you need to stay upright. That's because it's challenging to your proprioception. It's very hard to balance over an uneven surface because we can't rely on those proprioceptive cues. So adaptations you can make are thinking about the flooring in your house. If you have hard flooring everywhere, it's going to be easier to balance. If you have big, thick, fluffy carpets, that can be hard to balance on. So think about your stairs. That's somewhere where we really need to balance. You want to have a pretty sturdy floor there so that your feet can give you the right cues. And then think about the shoes that you're wearing. Are they giving you good cues about where you are in space? I know we all want to wear fancy shoes, but heels are obviously going to be very challenging to balance for various reasons. But even a minor heel that you wouldn't even know, I'm not talking a stiletto heel. I just mean like maybe a half-inch heel can even throw us off a little bit because we're feeling tilted forward. So just thinking about and being deliberate about shoe choice can help with balance. Also, sometimes we don't know that our vision is bad. And if it's bad just a tiny bit, that can really affect your balance. So we always recommend that people get screened by an ophthalmologist, a neuro-ophthalmologist if possible, just so you have a really good picture of your vision at all times. And then also simply increasing your base of support can help with your balance. So if you're brushing your teeth and you're finding it's hard to balance while you're doing that, if you just have a wider stance, so spread your legs a little so your feet are a little bit wider than hip width apart, that'll be a lot easier to balance. If you're standing on a bus and you need to balance, increase your base of support. Those are all easy adaptations you can make to address decreased balance. Spasticity. Spasticity is one of the most challenging things to treat. But we know we're learning so much about it, and we're getting really good at treating it. But by definition, spasticity is a velocity-dependent resistance to stretch. So if everyone knows where your biceps is. Your bicep flexes your elbow. So pretend you're eating. You're bringing something to your mouth. That's your bicep working. If you leave your hands at your mouth and you relax and you have someone slowly bring your arm down, slowly. If you have spasticity, or if you don't have spasticity, someone is able to bring your arm down slowly. However, if someone pulls your arm down quickly, like you're trying to eat a piece of chocolate cake and they want it and they're trying to pull your arm away from your mouth and you have spasticity, that is when you will elicit that like that spasm. It's where your arm is resisting that stretch. Your muscle is saying, you're not moving me. So that is spasticity, and that can really impair our ability to walk. Left untreated, it can make your arm or leg or ankle eventually become stuck in a position. It's called a contracture because you're not able to get out of that position. So your arm is always bent, or your ankle is always, your toes are always pointed down. You can see how that would really impact your function. So things that therapy can do to help you adapt to spasticity. PT or OT can teach stretches. You can trial different equipment. They can help you determine if a pump with your doctor, obviously, but if your pump is a backlist and pump is appropriate for you. OTs can teach positioning to prevent long-term complications and contractures. A recreational therapist can show you fun things that would, if they knew, for example, your ankles were tight and at risk for a contracture, well, what could they do with you in standing that you love to do? Throwing darts, doing archery, playing Wii. There's a million different things that I think are fun to do in standing that would help you stretch your ankles. And then counseling can actually help a lot with relaxation strategies, meditation strategies to help you turn everything off so that you're getting through full range of motion with in all of your joints. So those are all the things we can do with spasticity. There's many more, but those were just a few. A lot of people complain of a decreased memory or difficulty thinking, foggy thinking. Again, the speech therapist is really, really great at treating this. They can, and of course I have to say, they can help you, first of all, really try to recover that, increase the speed that you can think. They can, during treatment, play cognitive games, challenge you to help you improve the speed of your thinking. But to adapt for that, they can help you with daily planning, daily schedules, to-do lists. There are a million apps now that can help with medication reminders, just general schedule reminders. They can help with problem solving. And then counseling can help by doing all of those things, but also if depression is an issue, they can help with that as well. And on that note, the next symptom I wanted to talk about is depression. And this is a little bit of another area of passion for me, is that depression is very common in MS, and it is very, very treatable. So please seek help if you feel like you are, depressed, a tiny bit depressed, more sad than you think you should be or used to be. There is a quick solution for that. You can feel better soon. So call tomorrow. If you haven't called someone already and you feel like you're sad, do it. You will feel better. So finally, the last way I wanted to look through or talk about adaptations in therapy were just to look at it from therapist-specific things. So adaptations and physical therapists, what can they do to help you adapt to your symptoms or to MS, to help you live a fuller life and reach the goals that you want to reach? We've mentioned an AFO before. That's the ankle foot orthosis, helps with walking. FES, functional electrical stimulation. There's actual units that can stimulate the muscle that raises your foot based on when you're walking. I can't say enough good things about those devices. They offer recovery and compensation simultaneously. They can help you determine the most appropriate assistive device if you need one. And again, they're not just going to give you one and you have to use it. It's a conversation. You may not need one all the time. You may not even know about some of the devices that are out there. There's a lot of new, really cool, innovative assistive devices. They may recommend a wheelchair to help you with mobility, or to even just at times, maybe to conserve energy. Maybe you're going to Disney World and you need to conserve your energy. Bed rails and poles. Bed rails can help with energy conservation quite a bit. I don't know if you've noticed, but it takes a lot of energy. It takes almost every single muscle in our body to roll our side and sit up. So that's a lot of energy to use first thing in the morning. So bed rails just can be a simple thing to install and just have to use to just conserve a little bit of energy right in the morning. There's also poles that you can, you put them in your house and they rotate. So they can help with transfers. They help because they give you weight bearing every time you transfer. You can pull up and stand up with them, and they rotate so you could twist and sit in a chair. A lot of people have them in their bathroom where they can pull up on, rotate and sit down on the toilet, or rotate and sit down on the tub bench. PTs can also do family training. All therapists can do family training, so I'll just say it right now and skip it on the next few slides. But having your family or a caregiver or someone else in therapy with you is a great way to adapt, because they're hearing the same things that you're hearing. You're both going to have different takeaways from it, and you can sort of put some things on them, and then they'll understand a little bit more, I think, of what you're going through. So that we always really encourage families to come. And then we talked a little bit about transfer equipment, but there's all different kinds of transfer equipment, from lifts in the ceiling to power lifts you can use to get in your car. OTs can do a lot of the same things, but additional things are creating splints. There's the functional electrical stimulation for upper extremity that can help you grip things, cups, pencils, anything that you would need to grip that you would be having trouble gripping due to decreased hand strength. They can help determine the most appropriate bathroom equipment for you: tub bench, shower chair, maybe just a strategically placed grab bar. They can work with your physician and refer for Botox if you're having issues with spasticity. Botox poisons, which is a scary word, or turns off the muscle so that you're not having to deal with spasticity in that muscle. Again, spasticity is a big deal because it can decrease range of motion, which can interfere with function. OTs can do home evaluations to help with energy conservation and to help with modifications if needed, where to put a ramp, how to build a ramp, which doorways to widen. They also have OTs have a lot of specific knowledge about kitchen utensils. So special knives, special utensils. We talked about if you have decreased hand strength, there's a lot of different kinds of utensils you can use that don't require as much grip strength. Speech therapists, they can help you with a daily schedule. They can assist with technology for reminders or for any type of setup you need in your home even. You can control your lights, your alarm system, your computer, your TV, all from your phone. They also are great with home evaluations for creating all of those things and bringing it all together for you. Adaptations and vocational rehab. So we talked about vocational rehab, and a vocational rehab therapist can come to your work and help you get things set up so that it is ergonomic for you. They can be an advocate for you in your work to ask for the appropriate modifications, and they can be great, just educating you about what your rights are in the workplace, and even helping you find an appropriate job or volunteer opportunity or anything that would help you increase your vocational wellness. Recreational therapists, we've talked a lot about them as we've gone, but they can just help you get to do the things that you love to do. So they can help you find different equipment for biking, skiing, water skiing, rope courses, shooting, bird watching, cycling, any sort of sports. There is a way to play it. We have a team, I think, for almost every sport you can think of at the Shepherd Center. Everything from archery to basketball. There's a way to do it. And then they can also, a recreational therapist can also help you access the community, educate you about transportation. If you're in a wheelchair, for example, flying with a power wheelchair can be very intimidating, but a recreational therapist is really good at navigating that and can help you. And finally, adaptations and counseling. When I think about counseling, I think a counselor is the person that can help you become more adaptable if you're having trouble with that. And then also it can obviously help you improve your relationships if needed. So I wanted to end with just saying we went through the definition of adaptability. We went through the different roles of different therapists. We talked about what wellness means and how it all comes together and how being more adaptable and having a therapist can help you become more well in a very holistic and balanced way. But the most important person in all of this is obviously you. So I have a slide here that says Team Me. And even though it's the therapist that has the tools to help you, it's all about you and what your goals are and what your needs are. So every plan of care should be developed around what you need and very specific to you. So in conclusion, wellness is our goal despite health challenges like MS or hypertension, etc. And it is possible through adaptation. Rehabilitative therapies can help you adapt to the symptoms that sometimes may accompany MS. So the last few slides I have are motivational slides. One says fall, stand, learn, adapt. And the next one is a beautiful picture, and it says, the art of life is a constant readjustment to our surroundings. So that is all I have. Thank you so much for listening, and I am more than happy to take questions.
Wonderful. Before we begin, let me just tell folks, if you have a question, if you are online, you can hit the raise hand button. You can either enter your question by chat, or if you do not do that, and I see that your hand is raised, I'll go ahead and bring you on the line. Okay, we have our first question from Carla. Carla, go ahead.
Yes, I was curious to know, I know you're from the Shepherd's Center in Atlanta. How do we get to you? I mean, does it have to be referred via a doctor, or do we just call the Shepherd Center and ask for an appointment? How do we accomplish that?
You can call the main number at the Shepherd Center, and they can refer you to a case manager in the MS area, and they can help you get to therapy. So typically all we need is an order from any doctor that, depending on what discipline you need, that would say PT, eval and treat, or OT, eval and treat, or speech, eval and treat, and then we can go from there.
Do you know if typically Medicare is open to that as far as assisting with the finance on it, or is that just kind of, okay.
PT, OT, and speech are fully covered and reimbursed by Medicare. There's a limit, but it's covered.
Okay.
All right. Thank you for your question. Okay. We have a question that's asking from Mara Lucia, can we get a copy of the slides? Let me let everyone know that this presentation will be archived on the MS Focus YouTube channel. So you will be able to both see the slides and listen to Anna Berry's presentation. All right. If we have any additional questions, let's see. we have a question from Mary Taft. Go ahead, Mary. Mary? Okay. I had a question that came up. You talked about the difference between recovery and compensation. Many times we hear people say that they were told, oh, don't start using a cane, you'll never get off that thing. Is there any truth to the idea that using some sort of aid for compensation will stop you from making a recovery?
That's a really good question, and it's a really tough balance. I think I touched on it a little bit when I talked about sit to stand. There's an easy, energy efficient way to do that, but I don't want you to do it all the time, because if you do it all the time, the muscles that you use to do sit to stand are not going to be challenged every time you do sit to stand. And that also comes to play with assistive devices. Again, it's a tricky, and I think it depends with every person. So, for example, if you stop walking because you are falling, well, you're going to get weak. Your core is going to get weak. Your muscles are going to get weak, and you're going to get, your balance is going to be decreased because you're not walking every day. But if all you needed was a cane to keep on walking, well, you would have actually gotten stronger, because you're using the cane and continuing to walk, and probably walking further than you were walking before you had the cane, because you're conserving energy and helping your balance. With that said, I don't love a cane. I prefer a bilateral device, just because it's better for maintaining symmetry. But so I know I gave you 3 different answers to one question, but I guess the short answer is it really does depend, and it's a balance. It's better than falling, and it's better than not walking. But if you don't need it, you shouldn't use it all the time.
Absolutely. All right. Our question from Mary came through in chat, and her question was actually about where she can find the MS Tool Kit, and I can answer that for everyone. If you go to the MS Focus website, that's msfocus.org, and click Get Involved, you'll see awareness campaigns. That's the home of the National MS Education Awareness Month information, and there is a link on that page to request your awareness kit. If you click that link, you follow it down, fill out the form, your free awareness kit will come in the mail. That contains the toolkit. It contains information that you can share with people who maybe are not familiar with MS, who would like to learn more. And it also has your orange awareness wristband and some other goodies in there that I think you'll really enjoy. So go ahead and order your free MS Awareness Month Toolkit today. All right. If there are any other questions, this is your last chance, folks, to go ahead and hit that raise hand button. Okay. Well, with no further questions, then I just want to remind you that this presentation will be available. It will be rebroadcast on msfocusradio.org, and it will be available on demand and on the MS Focus YouTube channel within the next few days. You can follow the Multiple Sclerosis Foundation on Facebook, Twitter, or Instagram for the times and access information. Our sincere thanks to our sponsors for their support of this program, to all of you who called in or connected on the Internet for your support and participation, and especially to Anna Berry. Thank you so much for the time that you spent to prepare and share this information with us.
Thank you for having me.
Any final thoughts?
No, I guess just that I encourage everyone to, I encourage and I hope that this empowered everyone to seek the therapy or any type of help that they need, because there's so much out there. And the MSF does a great job at providing information to help patients living with MS.
Thank you so much for that. And let me just mention to everyone that this is the first of our teleconference series for National MS Education Awareness Month. We have many additional teleconferences and live programs coming up over the course of the month. Visit msfocus.org and click events to learn more. And thank you, Anna Berry, for helping us kick it off in style. What a great program and presentation. Thank you. Good night, everyone.